Hello everyone. For today's video, let's learn and discuss about brain aneurysm cause, symptoms, and possible treatment. Let's first find out, what is brain aneurysm? Brain aneurysm, which is also known as cerebral aneurysm, is an aneurysm that occurs in the blood vessels of the brain. On a closer look, it looks like an abnormal bulge or a ballooning in a blood vessel, which is usually caused by a weak spot in the blood vessel wall. There are different types of cerebral aneurysm. The most common type is called a saccular or berry aneurysm, which looks like a small sac or pouch. Another type is fusiform aneurysm, which involves the widening of the blood vessel along its entire length. Fusiform aneurysms aren't as common as saccular aneurysms. There are more types of cerebral aneurysm that are considered rare, like mycotic aneurysm, pseudoaneurysm, blister aneurysm, and many more. Knowing the type of aneurysm can affect the treatment options and prognosis. It's important to consult with a medical professional for proper diagnosis and guidance. What are the causes of brain aneurysm? Brain aneurysms are caused by a weakness in the walls of blood vessels in the brain. There are several reasons why this may happen, although an exact cause isn't always clear. Some factors that may contribute and increase the risk of brain aneurysm include advanced age, family or personal history of brain aneurysms, high blood pressure, smoking, and certain medical conditions. However, it's important to remember that each case is unique, and not everyone with these risk factors will develop an aneurysm. Symptoms of brain aneurysm. A brain aneurysm rarely causes any symptoms unless it bursts. Unruptured brain aneurysms occasionally cause symptoms if they're particularly large or press against tissues or nerves inside the brain. Symptoms of unruptured aneurysm may include lost vision or double vision, pain above or around the eye, numbness or weakness on one side of the face, headaches, loss of balance, dilated pupil. If you or someone you know are experiencing symptoms of an unruptured brain aneurysm, you should see a GP as soon as possible. Symptoms of a ruptured brain aneurysm usually begin with a sudden agonizing headache. It is often described as the worst headache of one's life, like being hit on the head, resulting in a blinding pain. Other symptoms may include neck pain, nausea and vomiting, sensitivity to light, loss of consciousness, or seizures. A ruptured brain aneurysm is a medical emergency. Seek immediate medical attention if you develop a sudden, extremely severe headache. If you are with someone who complains of a sudden severe headache, or who loses consciousness or has a seizure, call your local emergency immediately. Diagnosis and treatment. Diagnosing a brain aneurysm usually involves a combination of medical history, physical examination, and imaging tests like CT scans or MRIs. Small aneurysms that haven't ruptured and aren't causing symptoms may not need treatment, but this depends on your health and the aneurysm. Treatment options depend on the size, location, and overall health of the patient. They can include surgical clipping or endovascular coiling to prevent rupture. It's best to consult with a healthcare professional for personalized advice and treatment options.